Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and my very, very special guest today, Dr. Tam Cummings. I'm super excited for you to be on the show today.
Thank you. I'm absolutely delighted to be here. Really am.
Perfect. And so today we're going to talk about the tools for the 9 most common forms of dementia. And I'm glad we're having this conversation, to be honest with you, because I have a lot of clients that come into the office and I say, what's your diagnosis? It's dementia. What type of dementia? I don't know. Dementia. Is there more, is there a type? The doctor just said I had dementia. Which doctor? The primary care physician. I'm like, okay, well, they only know a little, but not what you need, so this is going to be great. So we're going to talk about them. And so let's kind of hit the ball rolling. And so let's lay out the 9 most common forms of dementia.
Well, if you don't mind, let's start with what dementia is. Dementia is the umbrella term for a group of 128 terminal brain diseases. These are all terminal diagnoses. About 70 of those 128 dementias are considered children's Alzheimer's. So you and I never deal with them in our field. I deal with older people. You deal with adults. And the care is given by the parents. Of the remaining dementias, 9 of them constitute 98% of all the dementias. And so what we do to help families be able to go back to their doctor with better questions is we do what the doctors do to make a diagnosis. You take the person's age, sex, and their clinical features, or in the case of dementia, the behaviors that the family is witnessing, and then you remove everything it cannot be, and what you're left with is what it must be. And that's how any medical diagnosis is made. And so just by doing that with these 9 dementias, it gives families a much better understanding of what they're going to the doctor to ask about, because the PCP gets a paragraph on dementia in medical school. They do not study dementia. You have to have a neurologist who is a specialist in dementia. Most neurologists don't study dementia. You need a geriatric psychiatrist, because they study the brain and dementia, or you need a geriatrician. And most families that you and I run into haven't had access to those types of people or even realize it. So we start with those 9 dementias and remove what it cannot be. So I'll give you the 9 if you feel like you're ready for that.
Go.
You ready? All right.
Yeah.
The largest of the dementias is mixed dementia, meaning that the person has more than one form of dementia. And on autopsy and primarily through research out of Europe, we now realize that it is not at all uncommon for people to have 2, 3, 4, 5, or 6 different forms of dementia at the same time, which means this person has 6 different terminal diseases of the brain. And the hardest thing I think about dementias for families is that the person doesn't look physically ill until they lose about 1 pound of brain tissue and are in stage 6 of the disease. And because of social skills that you and I learned at about the age of 2, we begin to learn the social conversation of, hi, how are you? Oh, I'm fine. How are you? Oh, I'm fine. How's your family? Oh, they're fine. People think that if a person can do that social conversation, that's the same as cognition, and it's not. Yeah. The second dementia is the Alzheimer's group. And there's not one Alzheimer's. There are 4 identified groups of Alzheimer's, and then each one of those has variations and subsets. The next one is the vascular dementia group, and there are about 4 dozen identified vascular dementias, and rarely do I run into somebody, even with a specialist, who's been diagnosed appropriately with the correct form of vascular dementia, which is very important to the children and grandchildren because we inherit our cardiovascular system. The third dementia is the Lewy body, or the fourth dementia is the Lewy body dementia group, and there are 9 variations of Lewy bodies. It's not one, it's which one. After Lewy bodies, we have the frontal temporal dementias. This is the dementia we think of as of people who are in their 20s, their 30s, their 40s, their 50s. But as a rule of thumb, our teaching is If the person comes to me in their late 50s or early 60s, I must first rule out the forms of FTD, and there are 9 FTDs, frontal temporal dementias, meaning they're attacking the frontal and the temporal lobes primarily. I have to rule that out before we can begin to talk about a different dementia. After the FTD is Parkinson's disease dementia. Parkinson's disease dementia has now been pulled under the Lewy body dementia umbrella. It is now considered a variation of Lewy body dementia. And so what that has led to research is that if a person develops Parkinson's disease dementia, we're then watching for the onset of Lewy body dementia, followed by the onset of Alzheimer's dementia. So it is very common. If a person has Lewy bodies, they also develop Parkinson's and Alzheimer's. If they have Parkinson's, they also develop Lewy body and then Alzheimer's. The next one is Wernicke-Korsakoff, which is commonly called alcohol dementia. Now, I'm not talking, you watched your college football bowl game this weekend and you had a beer. I'm talking the day I asked the guy, do you drink? And he said, oh, 1 a day. And I said, oh, 1 what a day? And he said, a case of beer and a bottle of whiskey. That's the kind of drinking you're talking about. So significant amounts of alcohol on a continuous basis causes the brain not to be able to use or produce thiamine, and that's what leads to that dementia. And then there's the 8th dementia is Huntington's disease dementia. This is inherited. It is passed from the parent to the child. The child either has it or they're a carrier. And this is also our highest suicide group because the child knows they have it and they know what the outcome is going to be. Then the final dementia is chronic traumatic encephalopathy. This is commonly known as football dementia. There are 4 forms of this that have been identified so far. It even has its own separate staging tool because this is the only dementia staged in 4 stages the way cancer is. All of the other dementias are staged in 7 stages. And then because y'all are in the Houston area, you also have to always remember toxic dementias because y'all live in areas with large amounts of chemicals, large amounts of oil, large amounts of gas burning off. And in certain areas of the country, especially those areas where we see chemical things, we see a much higher level of Lewy body and Parkinson's disease dementias. So the way we would use this tool is I'll use my mother as the example. My mother is 83. She never played football a day in her life. I can mark off CTE. My family does not have Huntington's. That is inherited. I can mark off Huntington's. Wernicke-Korsakoff, my mother's never had a drink of alcohol in her life. I can mark that one off. She doesn't have Parkinson's disease, so she can't have Parkinson's disease dementia. I can mark that one off. At 83, she is much too old for FTD. I can mark that one off. Lewy body has these unusual hallucination and sleep behaviors. The 4 hallucinations that we tend to see in Lewy bodies are the person sees children, they see bugs, spiders, rats, and snakes, they see bad people coming to get them, and that can include a family member. That can include, I hear people around my house. I see people coming in my house. A lot of times they describe what sounds like a SWAT team or an army team coming to get them. And then the last one, and this is the one that we really have problems with families because they're embarrassed to tell the doctor, and this is exactly what the doctor needs to know. The person with Lewy bodies sees their spouse or their caregiver having sex with everyone, everywhere, usually out in public as well. My mother doesn't have any of those, so I can take off Lewy bodies. But my mother has obesity and cellulitis and hyperlipidemia and high blood pressure and AFib and documented stroke history. She grew up with a smoker. She lived with a smoker. All of those things scream vascular dementia. And vascular dementia is not something that comes on slowly. Your vascular system you've had always. So this is just the accumulation of decades of things not working quite right in the vascular system. And what we know about any dementias, if you have it in place long enough, Alzheimer's would join it. So I will go back to the doctor for my mother to ask about vascular dementia, Alzheimer's dementia, or a combination of the 2. And that's how you use the tool.
Wow. Okay. Because, I knew there were different forms of dementia. I knew that. But to know that there's different forms in the forms, I mean, there's like subsets. It's actually kind of frightening when you think about it.
But when
And
you're talking to people, if you explain it, think about how you think of cancer. You've been taught that you understand cancer is an umbrella term. It's not the name of anything. And if I told you I had cancer, you would say, which cancer? If I said I had breast cancer, skin cancer, bone cancer, lung cancer, you would say, which one? And then you would ask me what stage it is, who's my specialist, where will I go for care in the end? And families of people with dementia don't understand the questions you ask for cancer. And you and I have actually been trained to ask about 30 different questions, that those are the same questions you ask if the word is dementia. Because as you said in the beginning, your clients come to you and say, my loved one has a diagnosis of dementia. And that's not anything. That's just that doctor has not completed their work. We
No.
need to know which dementia, because Lewy body and Parkinson's people are extremely sensitive to medications. They cannot have the antipsychotic medication other people do. Some of the medications seem to be effective on vascular dementia. With other doctors, they'll tell you they see no effect of those medications at all. And so the type of dementia a person has is critical for the family, because I don't smoke, but my maternal grandfather had small oat cell carcinoma of the lungs and died of lung cancer, but it's still part of my medical history. With the dementias, some of them are hereditary, and it's part of the person's medical history. So we need to know which one it is, because it determines everything about care.
Yeah, I laugh and tell most people, it's like my mom has gifted me with all kinds of things, that already are going to go wrong, in life. I mean, I grew up in a family of smokers, never smoked a day in my life. Grew up in a family of smokers. Mom smoked up until she was 50, had a heart attack, stopped cold turkey, and she said that last cigarette I took was the worst taste I'd ever had and never wanted another one. I was real surprised about that. But
And these folks were smoking cigarettes without filters. They were
yeah,
smoking real cigarettes. Yeah,
so
absolutely.
yeah, and so when you're talking to clients, and so I think for the most part is, clients come in, they say that's my loved one's been diagnosed with dementia, but obviously there's so many different kinds. So what does that mean to the client? What should they be doing?
They should be looking for a dementia diagnosis center. And in Houston, y'all have several. A lot of times you're going to find the place that does the full testing will be at a medical school for one of the universities. So you start there. You can also look online for the testing centers near you. And testing is not the mini mental status exam. The mini mental status exam was developed by Folstein and Folstein in the 70s as an orientation test, so that if you fell down and hit your head, we could take you to the doctor. They could ask you a series of questions, and if you didn't know the answer, it indicated something was bleeding that shouldn't be. The test for dementia are the SLUMS test, the St. Louis University Mental Status Exam, or the Montreal MOCA test. Those are the tests that are actual cognition tests. And the person with dementia can pass the MMSE on average 5 more years, when if you had given them the SLUMS test or the MOCA test, it would have identified that there was a dementia process happening, and it would have allowed that family to make financial decisions, to make decisions about how to protect their assets and how are they going to care for their loved one. And because of how it's done in our country, by the time the doctor says your loved one has dementia, they're already in stage 5 of the disease, which is the start of the terminal stages. The terminal stages are 5, 6, and 7. It's too late for medicine. It's too late for anything except for the continuation of a terminal brain disease. Another interesting thing is, in Europe, they tell the family the person has this form of dementia and it's a terminal brain disease. In our country, we tell the person with the brain disease they have dementia, and the problem is they can't remember it. I got a phone call one day from a woman who was furious at her husband. She said, he went to the doctor and forgot to tell him he's having memory issues. And I said, ma'am, I want you to write that sentence down, read it out loud 3 times, and then call me back. And I hung up the phone, and sure enough, She called me back a few minutes later and said, so I should have gone with him. Well, duh. Yeah. If you think the person's having memory issues, you sort of need to go with them to the doctor.
My mother doesn't have memory issues, and somebody's with my mother at the doctor when she goes. So, and definitely
the doctor is intimidating to that generation. You and I, if we don't like what the doctor says, we'll go get another doctor. But that generation goes, oh, the doctor said it, it's written in gold, I must follow this rule. And they do react differently than you and I would.
Well, I learned the hard way because, and two, with even my generation, I grew up thinking, well, the doctors know everything. That was in my head. Don't know where it came from, but doctors knew everything. And until I was very involved with my grandfather's care, him in particular, I realized that, I was living a version of House. The medical series of we're going to look at these symptoms and we're going to test for that, and we're going to look at these symptoms and we're going to test for that until they figure out what it is. It's a guess. It's an educated guessing game. And so that was shocking for me to come to that realization. And I tell clients that all the time. You have to understand they're making educated guesses, so you have to get more information, always. And so, but listening to you, it seems like a lot of the dementia tools are observational. Is that true?
Oh, it's absolutely true. I mean, how can you ask a person with brain damage to give you a correct answer or a correct history? That's a little foolish on our part. So the tools for dementia, whether it's anxiety, psychosis, depression, pain, are all observational tools. Our staging tools are observational tools because we are observing their behaviors. And from that, we're then able to assess and determine what treatment is needed.
And so, well, I'm going to go back a little bit and kind of back up just a little bit because I'm very curious about the stages of dementia and how someone determines what stage you're in. How does that work?
The original staging tools were 3 stages, and those tools were written for research neurologists whose IQs are probably close to 200. They were not written for a doctor to understand, even a neurologist to understand. They're very, very complex. So in the 70s, that began to be broken out into a 7-stage tool. Now, you and I are stage 1, not because we're going to get dementia. We're stage 1 because every staging tool must have a baseline of normal, and you and I are aging normally. We know who we are, where we are, and what we're doing. Stage 2 is called mild cognitive impairment. Now, mild cognitive impairment can last for between 4 and 20 years. And originally we were told to look for befuddled professor. And when I work with families, I tell them, if you're talking to me, your person's probably in stage 5. If you have found me and we're having a conversation, that's how advanced it is. And that's just because research shows in our country, people don't look for outside help until their person reaches stage 5, because now it's becoming more and more apparent something's wrong. But stage 2 is called mild cognitive impairment. Stage 3 is where the word dementia would be used for the first time. Oh, and let me tell you, the reason I tell families don't look at stage 2 is when you look at mild cognitive impairment, one by one, you and I do those behaviors frequently. You walk in a room and don't remember what you went in there for. That's normal brain function. You forget somebody's name, but these are names you should know. They show a mild interest that they're beginning to have cognition issues, but then they quickly dismiss it. Even if you said, let's go to the doctor, they would say, we'll go next week. Let's go get ice cream instead, which does sound more fun. So stage 2, I tell families, just look at it briefly, because it should tell you that 10 or 15 years ago, you saw these behaviors starting to happen, or maybe you don't live near your parent and you didn't. Stage 3 is where the word dementia is used for the first time, and it's called early dementia, but we want to know which early dementia. Stage 4 is called moderate dementia. Stage 5 is called moderately severe dementia. Stage 6, and at stage 6, the person's now lost 1 pound of their brain tissue. Stage 6 is called severe dementia. And stage 7, which is the bedbound stage, where the person is bedbound because without assistance or care, they cannot move or turn their body. They can't feed themselves or care for themselves. This is called very severe dementia. But again, we need to know which one it is. So what you do is you observe your person's behaviors. You take your dementia behavioral assessment tool and you check off the behaviors that you're seeing. If it's Alzheimer's, they just go down the slippery slope. If it's vascular dementia, and this is where so many people get confused, vascular dementia people stair step. They get stabilized on medication, but then they have another series of strokes or some other vascular event. And so the family thinks, oh, this is as bad as it gets. It doesn't get any worse. And then there's a stair step down. And so they can lose an entire stage over a series of vascular events that occur in a short amount of time. That makes sense?
Yes, frighteningly so. And it's like, oh, it makes you wonder, should I get an assessment now or later?
We don't have enough information yet. We know that you can carry the genes and never develop Alzheimer's.
Mm-hmm.
So, and we can't tell you why. In the identical twin studies where you think, oh, they definitely would both have Alzheimer's, only about 60% of them both have Alzheimer's. So why would you want to take a test that tells you you have these genes, but we can't tell you for sure if you're going to get it? That means you spend the rest of your life walking in a room and not remembering what you went in there for. I know that's normal brain function, but you now think, oh my God, it has started. You remember the name of that good-looking actor. You saw his movie last night. You love his movies. You followed him always, and you can't think of it. And you think, oh my God, now I've got it too. And in the middle of the night, you yell Brad Pitt. It just has to do with how your brain learned Brad Pitt. My brain learned Brad Pitt because he was dating Jennifer Aniston. And so I know he tried to crawl over and get in my Angelina Jolie file, but she kicked him to the curb. If my brain wants to find Brad Pitt, my brain always must go back to its original Brad Pitt file, which is with Jennifer Aniston. Mm-hmm. So families think, oh my gosh, I don't know that name. That means I have dementia. And then my favorite one, you've got several grandchildren, and to name your grandchildren, you have to start with the first and pull every single name out loud until you get to the right one. And then you've got families naming their kids crazy names. In my own family, we've got Dylan, Dixon, Demi, Dose, Denver, Davin. We've also got Kyla, Kaylee, Kelsey, Kinley, Finley, Conley. We got a lot of these. And I mean, how does that not drive a grandparent crazy? So grandparents think I can't do that. It means I have dementia. It doesn't. It's just normal brain function. The difference is, if you think your brain is not operating correctly, that is not a normal thought, and you need to go get tested, because there are 100 common things that can make a person appear to have dementia, and the number one of those is depression, and depression is treatable. The second one is anxiety. Anxiety is treatable. The next one is pain. Pain is treatable. So we need to find out what's going on with this person. It could be a vitamin deficiency. It could be a hormone slightly out of balance. So trying to get people into testing earlier is one of the big goals of our country.
You just mentioned pain. What does pain have to do with dementia? How does that?
Untreated chronic pain, and every decade of life gives you another level of pain, but you and I, our humans, are taught to suppress their pain. You look at a little girl falls down in the gravel. We all rush over and pick her up and dust her off. A little boy falls down in the gravel and we tell him to suck it up, get up. He's a man. He doesn't have any pain. You and I had cramps. They didn't have medicine for that. They just told us to shut up and go to school. And we did. I know, dragging one leg behind us and wanting to kill everybody. And that broken bone from high school now has arthritis in it. So every decade of life gives you another level of pain. It's just that if you sit and let yourself feel pain all day, you couldn't complete your job. You couldn't do what you're supposed to do. So you've been taught all your life to suppress pain. 50% of the behaviors in people with dementia are caused by untreated chronic pain. In Texas, you can give a person PRN pain medicine. Now, people think PRN means as needed, but let's take PRN one step further. PRN means I have a 3-pound brain. I know you're my nurse. I know my hip is hurting. I know to come to you and ask for my pain medicine. People with dementia don't have 3-pound brains. How would they ever ask for medication prescribed like that? In other states, the doctor is not allowed to give PRN medication to a person with dementia because the other states recognize they have brain damage. How would they know to ask? So we use a form called PAINAD, and it's all capital letters, PAINAD, and it stands for Pain Assessment in Advanced Dementia. And if you're a parent, you look at the scale and you go, this is what I did when I brought my baby home from the hospital. We know that. We just took it and added numbers to it. And what will happen is you do your pain scale on your loved one and you make sure that they get their pain medicine. People with dementia have at least one behavioral episode a day. We can control 50% of those behaviors by making sure the person has no pain. And you see physicians who don't understand this come in and remove arthritis medicine. When I go through charts and buildings, I see people who have arthritis diagnoses, but no arthritis medicine. I see people who have diagnoses that say pain diagnosis and no pain medicine. And so if we treat for pain, that's half our battle.
Wow, that's new for me. So that's really good information. And so I was like, wow. And this is phenomenal. If somebody wants to find you, how do they do that?
Well, I write my number on every McDonald's bathroom wall I come to. So check your local McDonald's. But if I haven't been to your area, my number is 254-216-3668. That's actually my real number. I really do answer it. If I don't answer it right away, it's just because I'm traveling. If you need help right away, keep calling. I mean, I'm not stupid. I'll figure out you need help right away. Otherwise, it may be a week or more before I get back to you. You can go to my website, which is tamcummings.com. And at the very bottom of the front page, and I understand you have to scroll for a while, is the tools section. And in the tools section, you will find the Cornell Scale for Depression and Dementia. It's an observational tool. You'll find the Hamilton Anxiety Tool, observational tool. You'll find the Brief Psychiatric Rating Scale, which is what the doctor is using in their mind when they give your loved one an antipsychotic. And so it's very powerful to know what that is actually being done for. And what happens a lot of times is families read the Brief Psychiatric Rating Scale and realize their loved one does need an antipsychotic because the right medication will take that edge off. And you can either have your person be like this, I'm trying to find the camera, be like this the rest of their dementia journey, or you can let the proper doctor give them medication so that we keep them as close to who they normally were as possible. There's Zaret's Burden Interview on there for the family member to measure their own stress level. There is the Caregiver Grief Inventory because the families are grieving. You're watching your loved one die a little bit at a time right in front of you, and you don't have any information telling you why that is happening. And so all of the tools on the website are free. They're on the public domains. You're available to use them. And we've even developed a staging tool for frontal temporal dementias. And most of the time when I meet FTD families, they've only been told their person has FTD. They haven't been told which FTD. And the FTDs are divided into behavioral, sexual, communication disorders, or movement disorders. And so you got to know which one in order to use that particular scale.
Perfect. Thanks so much. This has been phenomenal today. I can't thank you enough for being on the show.
Oh, I can't thank you enough for what you do. God bless you, girl.
See you soon.
Take care.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcasts as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.